The National Birth Defects Prevention Study (BDPS) conducted in the USA looked at the potential impact of maternal bottled water consumption on birth defects in infants. The study used a case control methodology, which means researchers compared a group of infants born with birth defects cases to a group of infants born without birth defects controls. The study data from over 15,000 mothers between 1997 and 2011 to analyze the relationship between maternal bottled water consumption and birth defects. The findings of the study suggested a possible link between maternal bottled water consumption and certain birth defects, specifically neural tube defects such as spina bifida and cleft lip or palate. The results were statistically significant, meaning that the association between bottled water consumption and birth defects was not likely due to chance. However, there were some limitations and challenges faced during the analysis. One limitation was the reliance on self-reported data from mothers, which can introduce bias or errors in reporting. Additionally, the study did not account for other potential confounding factors that could influence the relationship between bottled water consumption and birth defects, such as maternal diet or environmental exposures. Based on these findings, it is important for future research to further explore the potential link between maternal bottled water consumption and birth defects using more rigorous study designs, such as prospective cohort studies. Researchers should also consider potential confounders and factors that could influence the relationship between bottled water consumption and birth defects. The implications of these findings for public health and prenatal care are significant. Pregnant women may want to consider limiting their consumption of bottled water and opt for filtered tap water instead. Healthcare providers should also be aware of the potential risks associated with bottled water consumption during pregnancy and include this information in prenatal care counseling. In conclusion, while the NBDPS study found a possible link between maternal bottled water consumption and birth defects, further research is needed to confirm these findings and better understand the underlying mechanisms. This research has important implications for public health and prenatal care, highlighting the need for pregnant women to be mindful of their water consumption habits.